My name is Ewelina and I work for the Observatory as a researcher. In my work, I focus on what we know about health of people with autism. Together with my colleagues from the Observatory, we analysed information on people with autism which has been recorded in 2011 by the Scottish Government through the census of all people living in Scotland. Amongst many other things, this census information tells us how many children and young people were recorded to have autism and how their health was rated by their parents and carers. Autism was reported for over 17,000 children aged 0 to 15 years old and nearly 8,000 young people aged 16 to 24 years old. The rate of autism was rising up to age 11 in boys and age 10 in girls, reflecting age when children get diagnosed with autism. 3% of children aged 10 had autism, 4% of boys and 1% of girls. 3% of children aged 11 also had autism, 5% of boys and 1% of girls. 22% of all children and 26% of all young people with autism reported poor, that is fair, bad or very bad, general health, compared with 2% of children and 4% of young people without autism. Children and young people with autism were 11 times more likely to have poor health. Girls with autism had poorer health than boys with autism. The poor general health observed in children and young people with autism shows a clear need to focus on improvements in healthcare and support and the wider determinants of health in this group, which may differ from the general population. If you would like to find out more information about people with autism who live in your local area, have a look at our website at sldo.ac.uk and search for the census data by your local authority or health board.